I'm Jennifer Della Quadri, and this is Subtle Shifts, the podcast where you'll learn how to transform your life from the inside out, one small, meaningful shift at a time. Let's dive in. Welcome back to the podcast. Before we get into today's guest, I wanted to let you know that I'm doing something I have never done before, and that is offering free coaching to the members of the Subtle Shifts community. So if you've ever wondered what it's like to coach with me, or you're just wanting a space for professional development and learning and growing, and above all, connection with other women, this is going to be for you. So starting next week, which as of right now would be March, if you are in the Subtle Shifts coaching community, it's totally free on Facebook. If you are a member there, you will have access to these free live group coaching calls. I wanted to do this because I've noticed that as a woman and being surrounded by and coaching women, one thing that's really lacking is community. So friendships, connections, just a space to talk about the tough things and to hold and support one another, but also a space to grow and develop and transform and transition in your life. And I wanted to create this for all of you. So if you would like to be part of these calls, just click the link in the show notes to join the free Facebook community. And in that community, there will be events. You just say you're going. It's a Zoom link. You can join us. It's live. And I'm going to be holding them on Tuesdays right now at 6 o'clock Pacific Standard Time. And that may change just depending on who's able to show up and the schedules for everyone. But that is the time for now. I would really love to see you in there. Like I said, it's all totally free, and it's a chance for us to connect and learn and nurture one another, and you can also get coached. So click the link to join us there. Now let's get into today's topic. I don't know about you, but when I hear anyone talking about inflammation and how to have a healthy gut biome, my eyes glaze over. Mostly because I don't really understand how it all works, and I also just don't know where to start when it comes to doing anything about it. Now, we all know that the brain and the gut are connected, but did you also know that your gut is at the root of other things like depression, anxiety, brain fog, fatigue, digestive and hormonal imbalance? So we know medication can help with some of these symptoms, but it doesn't address the root cause. So where to start? That's why I invited today's guest on. Dr. Tracy McCarthy is a board-certified psychiatrist and Institute of Functional Medicine certified physician with over 2 decades of experience supporting thousands in transforming their health. She's dedicated to helping adults address the overlooked causes of chronic inflammation by focusing on underlying issues such as microbiome imbalances, nutrient deficiencies, and toxin exposures. She's empowering her patients to regain their health and vitality. And in this episode, she is going to share with you simple shifts you can make to start bringing yourself back into balance. You're not going to want to miss this. Let's go ahead and dive into the episode. Welcome to the show, Tracy. I'm so glad to have you here. And I know you're going to be talking about a lot of really great things for the audience. And I expect to learn quite a bit myself. But before we get into what we're going to talk about, take a moment and just explain to the audience who you are and what you do.
Thank you so much for having me. So my name is Dr. Tracy McCarthy. I'm a functional medicine physician and psychiatrist. And what that really means is that I'm focused on identifying and addressing root causes of symptoms like anxiety and depression and brain fog.
Yeah, and I definitely wanted to have you on because I know so many of our listeners, the listeners of the show, would benefit from your expertise. But I'm curious to know how you got involved in this specific realm of medicine?
Yeah, that's a great question because it's not where I started. I am a classically, sort of traditionally trained medical doctor. In allopathic medicine, it's called. That's what allopathic medicine is, MDs. And I was really, when I went into medical school, I was very excited to find out why people get sick, what's going on in the body, how do we work with that and help people to get better. And the first few years of medical school were actually really fun for me, learning all this pathophysiology. I'm really starting to understand the body. But as the time went on with my training, it really became increasingly about recognizing the pattern of symptoms, which makes sense, but then labeling that with a diagnosis and then matching that diagnosis to a pharmaceutical intervention. Mm-hmm. So much of it was about the pill for an ill. And when I was practicing, or as a resident really in training in psychiatry, it started to become frustrating to me to feel like, and to my patients, they'd ask, do I need to take this pill for the rest of my life? Or, it's not really working that well, or it's treating some symptoms but not others. It's giving me side effects. And feeling like that, is that the limit of what I can offer them? Because we're not addressing why they got there in the first place. And, when I would ask why, I wouldn't get good answers. Often it was like, well, we don't know. We don't know what causes schizophrenia, and end of conversation. But, I was really fortunate because around that time that I was becoming more frustrated with that, I really got to learn about the literature and the research on chronic inflammation and the role that plays in symptoms and how that can show up in so many different ways for us. And I got really, really fascinated with that, really went down the rabbit hole and started to change how I ate and lived, because I saw that really these things are huge influences on that chronic inflammation. There's a lot we can do. And started to feel differently myself. It's just some different, like, for example, I don't have to unbutton my jeans after dinner anymore, because it's like I'm digesting better and feeling more energy, sleeping better. So as I learned this and saw really amazing examples of people overcoming autoimmune disease in some cases, or other chronic symptoms, I really began to wonder, well, will this work for mental health? Will it work in my area of practice? And, it's funny now, it makes me laugh that I even wondered that, because my mindset is in such a different place. But, Western medicine is very siloed. It's separate. Like, there's gastroenterology for your gut, there's neurology for your brain, and it's like people aren't talking together. And I really felt like the brain is so separate. And of course, that's ridiculous. It's in our body. It's all connected. That's really the theme, is that it's all connected, and things show up differently for different folks, but a lot of these triggers are the same things. So I fortunately saw a few examples of people applying this in a mental health space, and was able to learn about the role of the Institute for Functional Medicine that trains physicians in these interventions and in this root cause approach. So I got to train and start to apply this, and realized I needed to start a private practice to actually be able to work with patients this way, because at this point I was an inpatient psychiatrist, meaning I worked with hospitalized patients who were severely, in a crisis. Mm-hmm. And there wasn't the sort of room to do this kind of work there. And as I began to work with patients privately, and realized, hey, when we work on their nutrition, a bunch of things get better. And then I started work on digestion, saw more improvements, start to work on hormone balancing, start to help them detoxify from toxins such as mold. And, the results would just mount and mount. And that brought me to where I am today, where I get to partner with people to identify what is going on, help them understand and learn, and really empower them to get better. Because yes, we use medications sometimes, we use lots of supplements for targeted, projects, but the lifestyle piece, the nutrition piece, that's the biggest part. And the rest of it doesn't work if you don't do that. So it's just, I feel so fortunate now, because I get to help people in this deeper way, and it's satisfying to both of us, the patient and me.
Mm-hmm. And it's so needed. And I for sure, just as someone who's not a medical practitioner, I feel really frustrated with the lack of connection between the two, right? And
yes,
I've told my audience about this, but my daughter struggles with severe OCD. And when she was inpatient, she would talk about the food that they would eat in the cafeteria.
God, I
And I
know.
was like, okay, I get that like there's definitely some parameters around, the funding and everything, and maybe they can't afford XYZ, but the importance of addressing the whole person is so essential, and it's so overlooked so many times, which is why I wanted to have you on here, because there are other ways.
Well, there's
And
so
I
much.
agree, medication is a really fantastic
It's a tool.
avenue, but it is not the only avenue.
That's
And
right.
so let's talk a little bit about this. So tell me a little bit more about the connection of, and I'm somebody who is, as a layperson, I hear inflammation and all I know is like, I just imagine everything inside of you is on fire.
Yeah, it's kind of accurate.
So can we just start there and just tell me a little bit about what does it mean to be inflamed?
Yeah, such a great question. I don't think that's a terrible analogy. I mean, there is something is a fire, but inflammation is really our bodies trying to heal. It's the normal response to injury or infection. But the problem with chronic inflammation is that we're not just like mounting a response to this bug, getting rid of it, and then the inflammation going away. We have these triggers that are constantly causing the inflammation. It's like a battle that's never done, and there's all this collateral damage. That's what's going on.
Yeah.
And so it's not, these triggers aren't getting resolved by the inflammatory response. Unlike, an injury, like you sprain your ankle, it's going to get red and swollen and hot. Those are hallmarks of inflammation, but then it's going to get better. And these, there's these compounds called resolvins that take part in resolving the inflammation. There's all these pieces to it, but chronic inflammation is different. And it's like that simmering, burning little fire that doesn't go out and causes a lot of problems. And so the goal when that's happening is to figure out what are those triggers. And it can be as simple as what we're eating every day. And, your example, the hospital food, I know exactly what you're talking about. And it is heartbreaking. It was hard to watch that once I knew what I knew.
Yeah.
I'm watching people with, the snacks all the time on the unit where let's here, have some graham crackers. And I'm thinking most of these people with schizophrenia, like really shouldn't have gluten actually. And but nobody is aware of this or acknowledges it. So yeah, it's hard, but inflammation, it's really the common pathway by which most of these symptoms are showing up. And it's, one of the things that's hard, I think, for people to first understand is that why would that be depression in one person and, irritable bowel syndrome in another person and psoriasis in another person? And it's because of their genetics, their different exposures, their vulnerabilities, and how that adds up.
Yeah. I think that's why it can be so hard to do anything about it, because it is so individual.
Yes.
So something that works for another person may not work for me. I'm able to eat something and it doesn't impact me, but it impacts someone else. And so from my perspective, there's no, just eat this and you'll be fine. I know there's
That's right.
guidelines, but it also just kind of feels like so overwhelming.
Oh, both of those things are so true. Like, to get real healing, it does have to be personalized. And there's so much information out there. It is overwhelming for so many people. That's why when I'm working with people or, educating them or working with patients, it's, what are the fundamental things that are generally true as foundational steps? Yeah. Where might it be an exception for you? Start there. And those things are usually what I would call necessary, but not sufficient. Like you need to get on an anti-inflammatory style of eating, and that may make a bunch of symptoms better. But it's probably not enough. There's probably more next steps you have to do, but you did have to do that first step,
Yeah.
And the overwhelming factor, I think, is there is information overload. So you have to find trusted sources, and then you have to baby step your way with the steps you take. That's really, really important. Rome is not built in a day, and it doesn't work that way. We have to do one thing at a time, make a new habit. When that's easy, we can start to address the next thing.
And that's why this podcast is called Subtle Shifts. You do one small thing at a
name.
time, right?
Exactly.
To avoid that overwhelm. And I'm so glad you mentioned that there's just so much information coming out there, especially when you're on social media. And then, there's this influencer who's like, this is the magic XYZ. And, there's all these other people. And who is really being authentic, who is really coming from a place of wanting to educate and genuinely help, and who is just wanting to make some money. And people don't start because they don't know where to start. So I love what you said is you just start with the anti-inflammatory diet or what you're eating, and you make those small changes over time and then assess as you go, instead of being like, well, I guess I have to change everything about my whole life.
That doesn't work. No one would.
No, it
No,
doesn't.
and when people do a lot of things at once, they'll, push really hard on that, and then they fall off that wagon. That's not a way to have lasting change. And the good news is that these baby steps we're talking about, they're profound. I mean, this must be why you've named it subtle shifts, because they're subtle, they're small, and yet they have this huge, snowball effect. So it's very worthwhile taking those little steps.
Okay, so let's say someone is listening and they're thinking, I'd really like to shift my diet so that I'm eating things that are more nutritious for my body and hopefully will also address symptoms of depression and anxiety and hormonal imbalances and the disruption. Where can they start?
Well, that's a wonderful question. And depression is a great example because we know from the scientific research that depression is an inflammatory state. And when we see people get better from depression, we see inflammatory markers improve. That's even true if they respond to a medication and then get better. We see that there's a relationship there with the inflammatory markers. So they're having some role in inflammation in those people who respond. So how do we reduce inflammation? So there are some foods that will just simply increase inflammation in everyone. And then there's some foods that might do it in one person but not in another, right? Like somebody might have a sensitivity to a food. It might be a healthy food in general, but they have a problem with it, that individual does. But let's talk about the things that are generally inflammatory to everyone, because that's where we want to start. So, this is where processed foods are really a culprit for a number of reasons. One is these carbohydrates that are highly refined are very inflammatory. They call them acellular carbohydrates. So that the cell of the plant, that was in that grain, it's like broken open and there's the contents of the cell are out. And that's kind of a thing that will trigger our immune system. We're seeing sort of the insides of cells that we might not have seen if it wasn't so processed. And so those, just think processed carbohydrates for sure. Okay. What does that mean? That means sugar, that means bread, the pasta, it's really half of the standard American diet right there. Yeah. And then also the oils in these processed foods are very inflammatory. So most processed foods are made with very cheap oils like canola oil or corn oil or other oils from grains. And these oils are fragile and they get oxidized very quickly. So that is bad. That's how we get free radicals, and that's damaging to our system. And then they are also full of something called omega-6 fats. And omega-6 fats, we do need them for living. They're essential, but they are like the lighter fluid on the fire. They are inflammatory. They're part of the balance of our inflammation, our immune system. The omega-3 fats, which we get from certain fish, those are the brakes on the immune system. So we're supposed to have both. Okay. But what's happening in America is most people are like driving around with the pedal to the metal and no brakes at all because they've got tons of omega-6 from all this food, way more than they are supposed to have, and no omega-3s or very little omega-3s. So the whole situation is out of balance and it's very pro-inflammatory, meaning all the signals are saying turn up that inflammation, and there's no signal saying turn down the inflammation. Okay. So where to start as a person, trying to make some change to feel less depressed? Where can you remove some processed foods? Like where are you maybe eating a lot of these? If you're drinking soda, for example, that's a good place to start. Start with, I always say, the low-hanging fruit. Yeah. Can you replace that soda with some bubbly water that's flavored or something? And then, are you having French fries all the time, for example? That's that's fried in those very bad oils. That's the problem with that. And trying to make these shifts one thing at a time. You're not going to overhaul your whole diet in a day, and that's not the goal. Every time, though, that you can kind of make a replacement for one thing for something that's a bit better, you're making progress. And you start to send a different signal to your body, less of a strong inflammatory signal and more of an anti-inflammatory signal. So processed foods, number one thing you can do that's really going to make a difference. And then, adding in these anti-inflammatory foods, like eating the fish that are high in omega-3s like salmon or sardines, which most people don't tend to eat, but they're a really easy, cheap source. They're really good for you. Of course, you can take fish oil that has that in it too, and eating whole foods, whole vegetables and fruits, things in their sort of normal state. These are going to be anti-inflammatory and nutrient dense, like you said, what's going to be nutritious for your body.
Okay. Yeah, and that's all doable, one thing at a time, right? And over time. So you mentioned that that's kind of the baseline of reducing inflammation,
Yes.
then shifting your diet. What else can be done?
Well, you can have some supplementation can be helpful. So if you are, there's certain cases where people definitely need to supplement. For example, if you're following a vegan diet, you have to supplement with vitamin B12. And that's actually directly related to depression. Low B12 can absolutely show up as depression. If you aren't getting those omega-3s that I mentioned, maybe you don't like fish or you don't eat it, you do want to supplement with those. And there's other nutrients that are commonly low in people. So magnesium is a really common one. Hard to get enough in the diet these days. It's been depleted from the soil quite a bit. So adding magnesium, usually at bedtime. There's a lot of different forms of magnesium. So you got to watch out that you get one that's right for you.
Yeah.
But for example, magnesium glycinate is a great form that's not too laxative, and it's helpful for anxiety and sleep quality. All magnesium is pretty helpful for sleep quality, actually. But that glycine is helpful for anxiety. Okay. And so magnesium is a good one. Zinc is often low in people with depression. And then the B vitamins. I already mentioned B12, but folate, which is in dark leafy greens, B6, B2, B3, all of these have roles in mood. So sometimes just getting on a good multivitamin or a B complex, but trying to eat a nutrient-dense diet is really going to cover the bases and it gets you, you don't want to rely just on supplementation, but sometimes you do need to add to get enough.
Okay.
That would be the next step.
Yeah, that makes sense. And I agree I've started taking magnesium a little over a year ago and it's been wonderful. So yeah, highly recommend that. Okay, so we've got the foundation of a nutrient-dense diet, an anti-inflammatory diet, adding some supplementation on top of that. Anything else that you recommend?
Yeah, one of the things that I see a lot is that people have imbalanced blood sugar. They're riding the blood sugar roller coaster where it's going up and down all day. In particular, you see this in anxiety because when the blood sugar goes up and then it comes down and crashes, that can be a real trigger for anxiety. And it can be also a trigger for insomnia, like waking up in the middle of the night, feeling very awake, possibly feeling anxious, just feeling alert. That is because when your blood sugar drops rapidly or too low, you release adrenaline to rescue your blood sugar. So suddenly your body's surging with adrenaline. That doesn't feel good. And so there's some real simple steps you can take with your food to really calm that blood sugar roller coaster and even out your blood sugar. The number one thing is making sure you have protein at every meal. Lots of people are not eating enough protein. And I'm not talking about huge amounts, but like making sure, for an adult, a nice simple target number would be something like 20 grams with each meal. For some people, that might be a little bit too low, but that's going to be enough for lots and lots of people. And also having some fat at that meal. Not being scared of fats, having healthy fats. Those are the things that balance your blood sugar. And you need those nutrients. You need the amino acids and protein to make neurotransmitters that impact your mood, it's the building block of everything in the body. And the fats, same thing. You need those for hormones. You need them for your brain. So you need them for the nutrients, but both of those help balance the blood sugar. So they counteract the effect of the carbohydrates on the blood sugar. So making sure that you accompany those carbs with protein and fat. Often eating some of the protein first will blunt the spike of blood sugar that would have otherwise happened with that meal. And then some people need to kind of pull those carbs down, have less of them to even out their blood sugar. But the simple first step is protein and some fat with every meal. So that means even with a snack, it's a good idea to make sure, is there a bit of protein here and some fat? Because that's going to be a much more blood stabilizing, input to the body.
That's a really great reminder. And I mentioned this in a podcast a few episodes ago, so my audience has heard me say this before, but I didn't really realize how little protein I was eating until I started actually paying attention and
Yes.
logging. And I was a little bit mortified at the fact that the majority of my diet was carbohydrates. And I thought I was just being like a healthy eater, but it wasn't balanced.
That's really, really common. Don't feel bad. What's great is that you figured it out. I mean,
Yeah.
we see that all the time with people coming to our practice, that people who are, trying to eat very well, they're conscious about what they're eating, they're making a lot of good choices, but they don't realize that that piece is missing and their blood sugar is like all over the place. And when we get it balanced, they sleep better, their anxiety is improved. In that, I should also clarify, getting the blood sugar balanced lowers the inflammation. It keeps coming back to that.
Yeah.
And lowers the amount of insulin you need to process the glucose, the blood sugar, and that helps lower inflammation. So there's just a lot of ways we can influence this with just some simple changes.
Right. And once you see, I know I'm speaking from my experience, once I started noticing the difference in how I felt, it actually fuels my motivation to continue with it.
And I bet you last longer, like after
Oh,
a
yeah.
meal, right? Because if
Yep.
you're just eating the carbs, it's like 2 hours later, you got to eat again.
Right. Exactly. And I was eating healthy, and I've been a pretty healthy lifestyle for a really long time, but I never really paid attention to the macros until I did. And then once you learn it, you don't unlearn it.
Yeah, and then you just have that. First, it's like you're thinking about it a lot, you have that awareness, and then it starts to become an easy habit. Now you just do it automatically.
Yeah. Okay. All of this sounds really simple and straightforward, and I love the approach of just picking your one thing and starting there, and then
Important.
eventually, after a year, there's a lot that can have changed for you.
I love that you say that, because one of the things I really try to emphasize with people is to measure backwards. So to not always look at what you haven't done so far, because there's always more we could do, and we can quickly get demoralized and not feel good about ourselves if we just look at what isn't done. But if you're making changes over a year and you stop and you look back and you go, oh my gosh,
Yeah.
like look at all these wonderful healthy habits that I've got now.
Yeah.
And then you feel proud and motivated to keep going.
Uh-huh. And on top of that, you have the energy to do other things like
Yes.
exercising, going out of the house, having fun with your friends. Like it all just kind of cycles into a more positive lifestyle.
Yeah, exactly. And those things also lower inflammation. Being in community, this is something we're wired for. It's stressful to us when we're isolated, and that triggers more inflammation. And, being outdoors, exposed to natural light and the normal like rhythms of day and night, this is sending signals to our hormones, in our brain that's running controlling the hormones, about when we release cortisol, the stress hormone. And these are all just important lifestyle things that really help improve our health. They really help the body do what it's trying to do already in the healthy way.
Yeah, and I definitely sense more people being interested in the community aspect of life, especially after spending a while
Yes.
in disconnection. It's people are craving it. I want to be in community, and they're putting that out there, and I'm definitely seeing that more on my side, which is so good. I had no idea. I mean, it makes sense, but I had no idea that connecting with people can help reduce inflammation. I had no idea.
It's just like having a sense of purpose. And it's really because these are things that are important for managing stress. It's like what did we evolve to do? To be in, a tribe, or, in a group with other people working together. And so when we don't have those things, it doesn't feel right to us, and it is stressful. Just like we need positive physical touch too, like a hug is going to release oxytocin, the wonderful bonding hormone, and that feels good. These things are important inputs that our body's sort of expecting. Our DNA is expecting these.
Yeah, exactly. And I wonder, when I think about my listeners and my clients and the people I work with, when they are wanting to make a change and they don't know where to start, I wonder because there's so many things that you've mentioned that are so great, starting with that low-hanging fruit, like what feels good to you versus like cutting that out, taking that out, changing that, overhauling that, what would feel good to you, and then just start there. So maybe for one person, it's like spend a little bit of time walking outside with your dog and let that be the first step.
That's so important. I really, really agree with that because you don't want to start with the hardest thing. You want to start with the easiest thing.
Exactly.
And then you build momentum.
Right.
And, when you start taking that walk with your dog, you start naturally making more healthy choices because you start to think of yourself as a healthier person. It's amazing what it does. And you feel better from that boost of that walk and the sunshine and the time with your dog. And that's really true. And I think another thing you mentioned, like cutting things out, that can be very negative feeling, can trigger feelings of like deprivation. So often it's helpful to start with adding in, like, oh, I'm going to add in some salmon twice a week. Or I'm going to add in, these greens, and they can start to displace some of the other foods. And that can be a nice way to begin to approach dietary change and not feel like, well, I can't have this, I can't have that. And I think the language we use is also part of the problem and the solution, depending on how we choose it. So when I have realized that a certain food is a trigger for me, I try to say like that I choose not to have it, not that I can't have it. I mean, I could have it, but I don't want to have it right now because that's not going to help me feel good,
Yeah.
And
I'm choosing to make this decision because it feels right for what I want for myself.
yeah, like what's my goal? Or I know I'm going to feel good when I choose this food instead of that food. So I like to feel good, remind yourself, say it out loud, the language is pretty powerful.
Yeah, and I always think about, you're at a party and everybody's having the birthday cake and you're deciding not to. And there can be that peer pressure element too. So instead of, oh no, I'm not allowing myself to have cake, it's more, I'm just choosing not to have it tonight.
Yeah, and it doesn't have to be a big deal.
No.
And
It can feel like a big deal though sometimes.
Well, and I think a lot of people will say, there's a lot of ways people react to that, but I find one that nobody can really argue with is like, I just don't feel good when I eat that.
Yeah,
So
I love that.
So I'm not going to eat it, not like I have an allergy or a sensitivity or blah, blah, blah. Because then people like to be like, oh, did you have testing? Or it's like really none of their business. But I think who's going to argue with like, I just don't feel good when I eat that. Well, okay, you don't want to feel bad.
Right.
No
That makes total sense.
right?
Yeah. Okay. So this has all been really helpful. Any other last tips that you would like to share?
Well, one other thing that I think is overlooked is the role of digestion with all this food discussion. So you want to be eating the right foods, but you also have to absorb them. And a lot of folks aren't digesting well. That's another thing I see a lot in my practice. We test the gut in practice and we see, what is going on with the microbiome and the bacterial levels. Is there an infection? Are there deficiencies of important bacteria? But we also look at the digestive markers, because that can often be a problem where people maybe are eating the good fats, but they're not digesting them. And this really begins with the brain and slowing down when we eat. And this is a hard one in our culture. We're always multitasking and racing around and, wolfing down our food. But if we can take a minute and look at what we're about to eat and kind of take it in and eat mindfully, basically, look at it, anticipate it, notice details about it, that gets the digestive juices literally flowing.
Yeah.
And then when you then take your first bite, if you chew thoroughly, that's sending the signal to the stomach that food is on its way and it should produce enough stomach acid, which is critically important. Okay. And once you have, that is happening, you're eating the food, your stomach is mixing it with the stomach acid, that passes on to the small intestine. If there's not enough acid in that food, you don't release your digestive enzymes that break the food down and help you absorb it. So you got to get this whole sequence working right to be able to break the food down well. And the best trick for that is just taking some slow, deep breaths before you eat. Again, eating mindfully, being, noticing the food, paying attention to it, chewing thoroughly, giving digestion a chance. Because if we are in that rush sort of mode, we're basically in the fight or flight mode. Mm-hmm. And that is the opposite of the rest and digest mode. So that's the sympathetic nervous system, that's the fight or flight. And then the parasympathetic nervous system, that's running digestion. So it's not going to work well if we're in fight or flight. We have to shift out of that. And we're really meant to mostly be in the rest and digest state and just go into that fight or flight when we need it and then come right back out of it, not hang out there all the time. So that, thinking about that with the food is then how you maximize the benefit of these great food choices that you start making.
That is something that I never even considered. Of course, I knew that it's important to be present and mindful while you're eating, but I thought it was more just a matter of so that you don't eat too much or that you're actually paying attention to what you're consuming.
It is for that too.
Had no idea. You just explained something that I didn't know, but it makes total sense.
Yeah.
And so, yeah, that's definitely something that I know I can start integrating, is just being a little more mindful while I'm eating
Yeah.
and sending those signals so that I can actually absorb what I'm eating. Because what's the point in doing all of that work to make sure you're eating the healthy food if it's not actually going to be absorbed?
No, I'll tell you, sometimes we talk about, if you're really not absorbing things and you're taking all these supplements and you're eating all this really good high quality food, then you have what we call expensive poop, and you don't want that.
Right, I've heard that before.
Yeah.
That's right.
Right.
Nobody needs to spend money on that kind of thing.
No, it's a waste. And, you want to, often you'll feel different if you do this, like less heartburn or, better bowel movements or less stomach upset because things are working right.
Really great tip. I'll definitely be taking that on. Yes. Okay, great. So much good information shared here, like a wealth of information. I'm actually for sure going to be listening to this episode again because I was like, wait, I need to take notes. So this was really great. And I will be putting in the show notes all of the links so people can find you. Mm-hmm. But just if there's anything that, like the first step, what's the first step? And also if somebody wants to follow you, reach you, how can they learn from you moving forward?
Well, I'm on Instagram at Dr. Tracy McCarthy, and that's Tracy, Tracy, and McCarthy's McCarthy. And my website is drtracymccarthy.com. And those are good places to find me. And then I have a free guide that I think is something your listeners can utilize and get a lot of help out of. It's the top 10 overlooked causes of depression, anxiety, and brain fog. So these are these physical causes that you don't hear about when you go to your doctor complaining of, depression or, concerned about anxiety. This is not referred to. And, you'll get a good recommendation for therapy. You might be given a medication. That's the end of the discussion. There's a lot going on in the body that's influencing this, some of which we've talked about today. But so that is just a free couple page guide that they can get. And it's at drtracymccarthy.com/top 10. That's TOP and then the number 10.
What a great resource to be able to educate yourself. And then when you are talking with your doctor, having a little bit more knowledge about other potential causes or things to address. So great.
And it'll give you ideas of things you can start even doing on your own.
Fantastic. Well, thank you so much for sharing your time and your expertise with us. I really appreciate all that you've shared, and I know for sure that I will be making some changes after having this conversation. So it's been a pleasure having you here.
Thank you. It's been a real pleasure for me. Thank you so much for having me on.
Thank you for joining me. If you're ready to take the next step in transforming your life, be sure to subscribe so you'll never miss an episode. And if something resonated with you today, I'd love to hear about it. Share your thoughts, tag me on social media, or leave a review to help others find the podcast. Remember, the smallest shifts can create the biggest transformations. I look forward to hearing from you.